And get started. Our session this afternoon is complex PCI, left main, and multi-vessel disease. I think you'll find that we have a number of really outstanding speakers and topics to be really culminated by, I think, a outstanding case presentation. I'm Bob Applegate. I'm from Wake Forest. Joining me as co-moderators, Arnold Cito from UC Irvine and Dave Kandzari from Piedmont Hospital. Just a bit of housekeeping for the speakers. If you could restart the clock for Dr. Kandzari, please, just for 1 second. We have incorporated hard stops so that at the time of your talk, these slides will go off in the interest of keeping this all on time. So it's my pleasure to introduce Dr. David Kandzari, a state-of-the-art lecture on left main and complex PCI in Interventionalist Perspective 2013 and beyond. David, thank you for joining us.
Thank you, and good afternoon, and welcome to SCAI Orlando. As a co-moderator, how did I only limit myself to 20 minutes? This is a welcomed opportunity to share with you the ever-evolving dynamic of percutaneous left main revascularization and comparative outcomes with bypass surgery. My disclosure is principally related to research and grant support from the interventional device industry. Historically, studies with balloon angioplasty or even bare metal stents in percutaneous left main revascularization have led a very storied path with inconsistent, at best, intermediate-term results, and in the worst case, unacceptably high rates of restenosis that could converge into a safety issue that could be manifest as sudden cardiac death. Moreover, these early discouraging reports with percutaneous left main revascularization were compounded by poor patient selection and an ever still evolving nascent procedural technique. And expectedly and understandably in 2005, the societal guidelines recommended wholly against the performance of elective percutaneous left main revascularization. In fact, only afforded a Class 2B recommendation, only one level above the Class 3 recommendation for patients with unacceptable surgical risk. That said, although we have held as a standard surgical revascularization for left main disease, the evidence supporting this standard of care is actually, in fact, quite limited and based on quite historical data. As an example of a meta-analysis of historical studies such as the VA Cooperative Study, the CAST study, the European Coronary Surgery Study, there's a modest sample size of only 150 patients that supports a mortality reduction with bypass surgery. And in fact, in the larger CAST registry totaling nearly 1,500 patients, while there was a benefit with surgical revascularization, it was identified only in patients with very severe left main disease angiographically, with concomitant LV dysfunction,